So I'm going to Lyme Diagnosis now. And I'll just open this up. So you've got a couple of important links up here. One of the other issues is that folks have learned that if you see a bullseye rash, that's an indicator that you've been infected with Lyme disease. That's called the Erythema migrans rash.
And do you have a picture of that? Because I'm not sure. I've heard this mentioned before, but I don't have a good visual for it.
Okay, I'm just going to click on this. So this is a good place to look if you're not sure.
Oh, central clearness. So that, wow. Okay.
That's the class.
Looks like a spider bite.
Well, it's, yeah, kind of, but you've got with, like the spider bite is going to tend to be more like this, but you get this other ring. And the rash, however, isn't always exactly like this. It can look like a completely different kind of a rash.
Can you scroll that picture? I want to see what's below there.
Yeah. So here's an expanding rash with a central crust. And this is another way it can appear. This is a disseminated infection. What disseminated means is that now it's spreading. The Borrelia is spreading. So once the Borrelia is actually in the body, it disseminates within 15 minutes to the central nervous system. It targets the central nervous system, and some doctors really consider it a disease of the nervous system. When it really manifests there, it's called Neuro Borreliosis. So you can see here we've got, you look at that rash and you go, gee, what could this rash be? You wouldn't think Lyme because it's not a bullseye, right?
Right.
And and then there can be this kind of rash. So these rashes, if you've been bit, any of these rashes could be an indicator that you have it. But the rash only shows up in about 37% of the patient. And I'll leave that up. This is for doctors, but also you. This is one of those situations where the educated patient can be an enormous ally with a doctor who understands that this is a team approach. You're working together. So folks, learn about this, please. The patient history has to be taken. Here's another point. I was always taught that if you have a good, hard winter, ticks will be killed and they won't be as bad the next year. Well, that's not true. They can be alive and active all year. They are not killed by freezing in the wintertime. In fact, there is tick-borne disease in the Arctic. The ticks are active in the Arctic. The freezing has nothing to do with it, but possible exposure to ticks is one of the things in patient history the doctor needs to look for, and so do you. The physical exam is another important part, and I'll just read through this. The subtle signs are always present, but you have to look for them. Now, as I recall, this comes from the work of Dr. Horowitz, who is really one of the go-to guys in medicine who he worked at the epicenter of Lyme and has treated thousands and thousands of patients. A lot of them came to him who had been diagnosed with these other diseases, and he was able to find out, no, it's really Lyme. Or there's a combination with, like Lyme with co-infections. We'll get to that later. But for Lyme itself, many patients look fine, but they can't finish a sentence. So you listen to them. How are they talking? What's their cognition like? You do look for these rashes, these erythema migrans. You look at the skin temperature and color. Another sign is that the skin could be warm, but the feet are blue and cold, even though there's a good pulse. That's a sign of this autonomic neuropathy hitting the nervous system. Then there could be red crescents on the tonsils. They could have thrush. That's like a candida. Look for redness in the whites of the eyes. That's the conjunctival injection. Look for red streaks on the tonsils and the throat. And
Dakota,
yeah.
as you're reading these symptoms, how soon into this infection would these symptoms occur?
Well, here's the thing. It really depends a lot on what they call the terrain of the patient when they're first infected and the condition of the immune system. And that's why in prevention, we really emphasize keeping the immune system strong, because the immune system itself, if it is strong, can quickly eradicate the Lyme or minimize these symptoms. As far as this goes, generally folks have had it for a while before they actually go to the doctor.
Right, I would
And,
imagine so.
and so these things are probably coming along later. Now, definition of terms is tricky. There's acute Lyme, and that means that it's brand new baby Lyme that's just really now taking hold of the body. And that's the time, we'll get to treatment, I think, in a future show, but that's the time where if you hit it really hard with good antibiotics, be they antibiotic drugs, a good antibiotic herbal protocol, you can knock it out. Or if the immune system is just, really competent. Obviously, since Lyme's been with us for so long, people have survived it, and at any rate, but these are things to look for, I would say, at any time, and especially any combination of these things. So another one is, look, if people tend to get candida easily, or this candida overgrowth. Thrush is where the candida is in the mouth. If they're getting that kind of thing and having a problem, that's another type, another symptom. Another symptom you look for is something called orthostatic hypotension. And what that means is you stand up and you're dizzy. It's like your blood flow isn't quickly equalizing to gravity. Then also changes in the pulse, because Lyme almost always involves the nervous system, including the autonomic nervous system. You check for blood pressure changes with posture. Then you check for temperature. So the temperature tends to be low in the morning, high in the afternoon. Early afternoon, folks feel exhausted and need to lie down. The best time to do a culture study is in the afternoon. And it's also the best time of day to draw the blood. So if you're going to go get a blood test, try to get it in the afternoon, because the Borrelia is most active then. Then you, neurologically, the neurocranial nerves, including certain reflexes like the gag and corneal reflexes. There's a list of reflexes here that doctors should know how to check. And those reflexes can be completely absent or decreased because of the effect on the nervous system, or they can be delayed, and thyroid can be involved there. So if these nerve reflexes are really brisk, that can be a magnesium deficiency. So all of this stuff is kind of like geared towards the doctor, the physical examination. They can read this at every single visit, especially once Lyme is suspected or diagnosed. Every joint that's visible in the body has to be examined. And I suppose that's something that each of us could do regularly if we wanted to, because eventually you see changes, the doctor sees changes in the joints that other people would miss. And here it's looking for nodules in the muscles and tendons. The joints are starting to be malformed in some way. It could be subtle. There might be real tenderness in these nodules or joints. The most common area of infection is in the ligaments and tendons, not the joint. Okay, and there's something called the Lyme Shrunk. And what that is many of the Lyme patients have a stiff neck, and they're kind of constantly shrugging, trying to loosen up that stiff neck. Notice that. Notice, look for enlargement of the spleen and liver. Now, there can also be heart murmurs and gallops, and people can think that they're having a heart attack, and that can be due to something called chondritis, and what that is actually, it's an inflammation of the ribs where these costochondral joints are in the patient, and it feels like a heart attack, right? But it's not. It's like an inflammation in those particular joints. And if it's, check to see, the doctor checks to see if there's infection there. It can affect the lungs. So, and the doctors need to recognize that in order to diagnose Lyme, often you have to exclude other conditions. And that's where you start like really getting that high bill, you know, all the testing to rule out lupus. It seems like multiple sclerosis, but is it really? And all the testing that they have to do for that kind of thing. So this can be...
You bring up a good point, Dakota, and it was something that I'd like to create more awareness around, is that if in fact we're starting to identify tick-borne diseases as an epidemic, then we need those folks that do lobbying. We need to get the testing made free, because I'll tell you right now, I was tested for 5 different tick diseases. Now, fortunately, I was assisted, but that bill wanted to be $888.
Yeah.
Not very many people are going to be able to have access to that.
Right.
So just, make a mental note, folks. If we're having this epidemic, we really need to get some free testing.
Right, and there's quite a bit more to it also, because when it was first discovered, it was thought to be a form of arthritis. It was called Lyme arthritis. And when it came to the attention of the government and they realized they needed to start researching it and funding that research, because they thought it was arthritis, they designated it as a form of rheumatology, and they put all of their money into the branch of medical research called rheumatology. And so everything that was explored was in the context of it being a kind of arthritis. And that's, not their fault. It seemed like it was, but now they know. The doctors who are actually working with this and the medical researchers who are thinking outside of that box,
right?
As they're learning more about it, they're saying, actually, no, it's not. It's in the wrong department. It shouldn't be under rheumatology. It should be under immunology, because it creates a form of autoimmunity. And if we have time, we'll get into that. But so the money's going kind of in the wrong direction, looking at it, and that's why there's been a lot of controversy about it in the medical arena too, because when a whole lot of money is spent to prove something is one kind of disease, and the doctors have all been taught that's what it is, there's a reluctance to say, oops, whoops, made a mistake, sorry guys, we're gonna we spent a lot of that money in the wrong place. I mean, it's a legitimate mistake, but they've invested too much in it as a form of arthritis now, and it's still, even though we know it's not, it does create arthritis type symptoms. In fact, even in rheumatoid arthritis, they're now finding that, and this is again for those doctors who are educated in Lyme, when they get rheumatoid arthritis patients, they're doing cultures to find out if there's borreliosis there. Sure enough, in some of them, it's Lyme Borrelia, and when they treat them for Lyme, the rheumatoid arthritis goes away. So one of the things that can be done, obviously we're a long ways from really getting good diagnosis and treatment. The database, as I'm building this up for people, I'm designing it so that we can take care of ourselves if we lack access to the kind of testing and the kind of doctors that will do it and work with us. We can go in here and learn enough about it to say, I think that my ongoing fibromyalgia, maybe tick-related. I remember getting kind of sick after I had a tick bite or whatever. And, or I've done all the fibromyalgia protocols and I'm not getting any better. So in the database, you'll find several different protocols for treating Lyme, and we'll get into them in another show. You could just go ahead and do one of these Lyme protocols yourself if you read up on it and thought, you know, I'm just going to do this, because the really good natural protocols are treating it in such a way that they'll also work with other types of infections, and they are going to boost up the health of the body and the immune system and all that sort of thing. Oh, I almost forgot to mention, this is something else that I think is really important. One of the main people everybody should read online, a lot of medical doctors have read his work and respect it highly and have integrated it into their own Lyme treatment protocols, is the book by Stephen Buhner called Healing Lyme, and he's done a revision of it. So he knows a lot about it, and he knows how the herbal protocols work, and how the antibiotics work, and how to combine them if that's what you decide. So you have a lot of choices that you can make. I wouldn't do an antibiotic drug protocol unless I had a positive diagnosis that it was Lyme. Andrographis is an herbal tincture you can get, and you can mix it with green clay, and you can take that and apply it over the tick bite and keep it on there for a while. Andrographis, and this is one of the herbs that is used in Buhner's protocol. Let me just look up Lyme Prevention.
So is it a liquid or a powder?
Get it as a liquid, as a tincture, and then just mix it with some green clay. I will say this, one of the things that Buhner recommends for preventing Lyme in the first place is if you live where you know Lyme is being transmitted and you're potentially exposed to ticks, that you take 1,000 milligrams of astragalus every day. Now I do like taking, yeah, I do like taking breaks on even things like this, you know, just so the body doesn't get too used to anything, but on an ongoing basis, just taking 1,000 milligrams of astragalus a day. You don't take it when there's a fever. It's one of the cautions on astragalus. But when you're just normally healthy, take it, because it does boost the immune system in such a way as to help just keep the immune system on the ready in case it does encounter something like this. Fortunately, it's not real expensive to do that. I just got a bottle of astragalus in a capsule form, easy to take, 1,000 milligrams per capsule, 120 days for $10.
And this is a preventative.
Preventative, yeah. In case people all of a sudden go, where can I find a doctor? You know, it's here. Just, you know, subscribe to the database. Doesn't cost a lot of money. And you can be on your way with dealing with this. They estimate that there are 30 million undiagnosed Lyme cases in America.
Well, and let's be reminded, you know, we're becoming more educated as advocates and researchers. And so I think what we're starting to reveal, what's surfacing, is how much we don't know, and that our health, understanding our bodies, is going to be an ongoing event. And I think it's kind of going to move out of the realm that the medical profession has failed here, there, and everywhere. I think what we're moving out of is the medical profession just doesn't know everything, nor does any of us. So the real point here, and I think the point of the herbal database, is everyone become your own advocate, start
Yeah.
doing your homework,
Mm.
become a researcher. And we
Mhm.
don't, I think we can let go of comparing one
Mhm.
doctor to another. I think the point is just like what you have put in your database, Dakota, is that as you do the research,
Mhm.
you make your discernment about your health, about your choices,
Mhm.
and research your physicians.
Mhm.
And I guess just on a spiritual basis, like we don't need to judge who wasn't good or bad anymore.
Mhm. Yeah.
Know your doctors, know your
Yeah.
physicians,
Yeah.
right?
And help your doctors, you know?
Yeah,
You know,
exactly.
they don't have time. Once you start digging into the database, you'll
Mm-hmm.
see there's a lot to learn about
Mm-hmm.
this, and they may not have time.
Exactly, exactly. I think that's a really good point. So educate one another.
Mhm. Yeah. Okay. Well, thank you, folks, for tuning in. We'll be back in 2 weeks. You can join us on Herbal Knowledge Keepers. If you're in a hurry to see what else we have to say about Lyme, subscribe to the database itself because it's all there. And then you could be asking questions and getting clarification on our Herbal Knowledge Keepers Facebook group.
Right.
And so we're going to sign out. I just got a notice that my internet is leaving without me.
All right. Well, then it was good timing. So long, everyone, and stay
Hello.
healthy.
Mwah.
Mwah.